The picture-based health warning bill is still pending in the Senate, but anti-smoking advocates believe it's just a matter of time until lawmakers realize the measure is necessary to help Filipino smokers kick off the habit. Here's part 2 of my special report. According to the Framework Convention on Tobacco Control, or FCTC, the Philippines and the 177 member countries are required to implement health warnings on cigarette packs. These warnings must include a picture of the adverse effects caused by tobacco smoking to one's health. Canada was the first country to apply the rule in 2001. Now there are 63 countries with picture warnings. These countries combined makes up more than 40% of the world's population. Dr. Yul Doroteo, project director of the Southeast Asia Tobacco Control Alliance, believes that by the end of the year, the Philippines will adopt a graphic health warning law. This means tobacco companies will be required to print on the pack pictures of diseases acquired from cigarette smoking. The tobacco industry has agreed to comply with the FCTC rule, but health advocates now question whether the size of the picture will be large enough to be effective.
Very good chance that we will have picture warnings in this Congress. All of the tobacco companies have said that they are supportive of picture warnings, graphic warnings. And then in the lower house also, and even in the upper house, our usual pro-industry legislators are also accepting that they will have picture warnings. So the question really is not whether or not we will have pictures, but how big the pictures will be.
The tobacco industry is pushing for the smallest required size by the FCTC.
The industry is pushing for 30%, which is this size. And if we compare with 50%, or actually 50%, there's a big difference. If you have a picture that's this small, it really doesn't show you anything. People will actually read the text and probably not even understand the picture.
Though acceptable, international studies show that larger pictures have a greater impact among consumers, especially in low literacy populations.
Based on international best practice and research that's been done, obviously, the bigger the warning, the more effective it will be. It's just like road signs. I mean, if you want somebody not to fall off the road sa papuntang Baguio, then you want to have a large sign.
In countries with picture health warnings, studies show smokers tend to cover the picture warning while smoking, or are more likely to buy packs with pictures they cannot relate to.
They put their mobile phone on top to hide the picture. In countries where it's only on one side, so for example, let's imagine this is plain and then this is the picture warning. They put it upside down so that they don't see the picture. And then in countries where they have warnings, for example, with a baby, the male smokers choose this one because they say, I'm not going to have a baby anyway.
There are 18 countries with health warnings covering more than 50% of the pack. Australia is leading with 82.5%. Uruguay and Sri Lanka follows with 80%. Brunei and Canada at 75%. The remaining 13 countries have 52 to 65%, while 30 other countries have 50% coverage. For it to be effective, the FCTC requires changing and rotating the pictures every few years, citing getting used to the pictures can cause the smokers to be unaffected in time. Steep prices, advertising bans, smoking bans in public places are other factors that help decrease tobacco use. But one sector picture health warnings have proven to be most effective is with the youth.
The reduction is actually in the number of young people who start to smoke. There are surveys among youths where shown graphic warnings, they actually will tell you that they decided afterwards not to smoke.
We now know picture health warnings, if properly implemented, can be effective. Experts say it may take some time to see significant results, But in the long haul, we can only imagine a new generation living longer and healthier lives.